Pediatric beds filling up at hospitals across the country with several respiratory viruses circulating.
That includes the resurgence of RSV at an abnormal time here on the West Coast. KPIX5's Max Darrow explains.
Dr. Vincent Tamarez and support dog Posey have a lot of patients to attend to in the pediatric ER at Sutter Health's California Pacific Medical Center on Van Ness in San Francisco.
We're seeing a lot of what we call bronchiolitis, which is a specific type of inflammation deeper in the lung. It's not a nose infection or a head cold, it's a deeper lung infection. So we've really had a huge wave, and so we have multiple viruses at the same time. So we're seeing a shortage of pediatric beds across the country.
Numerous viruses can cause bronchiolitis, including RSV. Pediatric cases are surging from coast to coast. More than 70% of pediatric hospital beds are occupied nationwide. Tamarez says the timing of the infections is different than any other year.
Normally you can set your calendar by RSV, where it comes from the East Coast to the West Coast and it marches across the country. And so we usually see RSV much later in the winter, even into the next year, January, February.
He says the timing does make sense, though.
There's something called the immunology gap, or a chasm between 2 years ago and now. So these kids really haven't been building up a lot of the common cold viruses, a lot of the immunities when they're in their first year of life and second year of life. And so now here they are 2, 3 years old, and they've only had X number of colds where they would have had 3X.
RSV can cause coughing and wheezing. Tamarez says kids 5 and younger are typically the most affected. However, he says the majority of children who get sick will be okay.
It's a worrisome thing to see your child coughing and breathing faster and not eating as well. But the vast majority of children with bronchiolitis will get through it. It is rarely life-threatening.
The doctor says if your child is having a hard time breathing, you should take them to the ER. In San Francisco, Max Darrow, KPIX5.